cannabidiol, you said?
Cannabidiol.
Cannabidiol?
Cannabidiol?
So I've heard of CBD, but I'm not really sure what it is or what it does.
I really don't know what it is. That's the first time actually hearing about cannabidiol.
CBD, I think does it come from cannabis?
CBD is derived from industrial hemp, effectively. It's a compound found in the hemp plant, which has been isolated and purified and now is being put into clinical trials. It's been around for a long time. People have been using CBD in one form or another for a wide range of different ailments. And we're now in the process where we can actually put pure cannabidiol or pharmaceutical-grade cannabidiol into clinical trials.
Doesn't CBD make you a little high, you know?
I'm not really sure the difference between CBD and THC.
CBD, while it's a very close sister of THC, actually has completely different effects. It doesn't have the psychoactivity that THC does. It doesn't have the abuse potential that THC does. It appears to have a range of different effects like anti-convulsion or anti-seizure effects. It seems to have anti-inflammatory effects. It seems to have anti-anxiety effects. So very similar molecule to THC, completely different pharmacological effects.
What is CBD used for exactly?
How can CBD help me?
We're looking at CBD right now in various forms for pain, mood, and sleep, the big three pillars. And CBD, interestingly, appears to have effects both on inflammation and on anxiety. So while we don't think it's necessarily a pure pain compound, it's not like a pure analgesic, it appears to have these effects on both inflammation and anxiety, which together, in somebody who has a chronic inflammatory pain and is anxious, can really feel like an improvement in their pain.
Is CBD safe?
Is CBD safe to use though?
Are there any risks?
A 2018 WHO review concluded that generally CBD is well tolerated with a remarkably good safety profile. It's really important that patients know that they should obtain the molecule or the medicine from a regulated supplier in a package which clearly states the quantity of CBD and the dose form that they're taking so that they're fully informed about the dose that they're using. And this is important as well for the patient as it is for the physician or health professional who's advising them. Everybody needs to know what's in the bottle, what's the dose, and that way we can interpret the response.
So how do you take it? Do you cook with it?
Do you put it on?
Do you eat it?
A pill, an oil, a cream, tablet?
CBD can be administered in a couple of different ways. The most common is in the oral form, so taken as an oil or as a capsule or as a food product or inside a food product. And typically this route of administration gives rise to an effect that can take anywhere from 2 to 3 hours before it really is reaching its peak in the bloodstream, and then that effect can last for several hours afterwards. As with any medication, they should always begin with the lowest dose and gradually work their way up. And if a drug's not helping, it's not working, or if they're having side effects, they should discontinue it. That's just practical advice for any medication. If it does half of what we think it does, it's going to be a truly groundbreaking molecule.